Good afternoon.
Good afternoon.
Let's start with some numbers today to bring you up to date. So far in the state of Kansas, we've recorded 9,337 positive cases of COVID-19, which is an increase in 119 cases since this last Friday. We have 75,151 negative results recorded and a total of 205 deaths, which is an increase in 17 deaths since last Friday. This increase is due to the death registry review mainly impacting Finney and Wyandotte counties. As we've talked about in the past, the death records don't come in every day, test results don't come in every day in a linear fashion, and I think that the 17 we see recorded from Friday represents that there was somewhat of a batching during the holiday weekend. Cluster information. We currently have 113 clusters that we've monitored, 46 of which are inactive and 67 of which are active, accounting for 4,883 cases and 138 deaths. So if you do the math on that, it's approximately half of the positive cases have come out of these clusters and over half of the deaths. Corrections has 3 clusters, accounting for 986 cases and 6 deaths. Some good news to report from Lansing. We, as you know, have tested everybody there, offenders and staff alike, and we have continued to test and monitor offenders who are negative. In the past weeks, you'll recall we've talked about seeing a positive test result coming back in the 40 to 75% of the offenders in a sample of roughly 100 inmates at a cohort at a time. This week, in the group that we just got the results from yesterday of the most recent 110 or so, was down to 6.5%. So what we're seeing is, one, the good results from cohorting inmates that are infected away from those that aren't, the retesting of offenders who are negative, and then having that number continue to drop down, which is a very encouraging sign for in the correctional institutions. Gatherings, various kinds of gatherings, 13 clusters, 8 of which are inactive now, accounting for 145 cases and 11 deaths. This includes increased numbers coming out of the Lake Perry gathering from that first week in May that we've talked about. Group living clusters 6, 5 of which are inactive, 53 cases, 2 deaths. Hospital and healthcare settings, 5 clusters, 4 of which are inactive with 44 cases and no deaths. Long-term care, which is of course something that's been very much on our radar and taking a terrific amount of activity and effort. 30 clusters, 14 of which are inactive, 685 cases and 107 deaths. So right at half of the deaths in the state of Kansas from COVID-19 have been in long-term care facilities. Meatpacking industries, 10 clusters, 2,600 cases and 9 deaths. And finally, private industries, 46 clusters, 16 of which are inactive with 367 cases and 3 deaths. Mass gatherings. On Friday of last week, I warned about exercising caution moving into the Memorial Day weekend. While many of our citizenry heeded that warning, others did not. In our neighboring state of Missouri, it made national headlines with activities that occurred at the Lake of the Ozarks. I'm sure that while those may have been the ones that are most visible that made the news, I'm sure there were other situations around, probably in both states, but not as extreme as what we saw at the Lake of the Ozarks. As your state health officer, and you may have seen this from the press release we put out yesterday, I was extremely disappointed and frustrated by these photos and the videos I saw. Those individuals are not practicing public health recommendations, and they have now spread to other counties and most certainly other states, including Kansas. Knowing this, I want to put forth extreme caution and remain vigilant. This virus has not gone away. There is no vaccine available. We've been talking about this since March, and what we are doing has been effective at pushing down the infectivity of this virus. And yet it has not gone away. It will not go away if we continue to show laxity in terms of our attention to these public health guidelines. So far, we have been very successful in the state of Kansas working to flatten the curve. Now that the reopening plan will be made at the county level with the Astra Plan as guidance, I urge every county health officer and county leaders to monitor their hospital bed capacity diligently. The reason I say that is because if we see the conduct that we saw like at the Lake of the Ozarks, we're going to see an increase, and perhaps a startling increase, in the number of cases. I assure you, I'll be working with hospital and health system leaders statewide to keep close eye on the hospital bed capacity. We don't want those to be overrun. I urge businesses and other organizations to continue to look to the Ad Astra reopening plan related to mandates and public health recommendations. Yes, the Ad Astra plan for reopening is providing guidance, and I hope that it'll be seriously looked at and adhered to. The next several weeks, we are entering uncharted experimental waters. It will show us how the reopening efforts have impacted disease spread. I predict that some counties in Kansas will fare well, and some will fare very poorly. I don't like experimenting with people, and I consider this next period of time to be an experiment in disease spread and how it takes further root in our citizenry. And remember, my continuous theme, you are your own preparedness. Wear a mask, wash hands often, and practice social distancing. This morning, Major General David Weishar, our Adjutant General and Governor, and I met, and we're starting to look now toward what we're non-affectionately referring to as the second wave. We've come through the first wave of COVID-19 in the state of Kansas, and we're showing a progressive increase. Despite the fact you're hearing me report on new cases and new deaths, the number in all three of the reopening metrics are improving. And if people are diligent, those numbers will continue to improve. But as we look toward a second wave, and that's, by the way, how pandemics act, they have for hundreds of years. If you look even back in history, that's the way they've acted. We should not assume that we have to have a second wave necessarily. I think that what we should do is, yes, prepare for a second wave, and a wave could come in ripples, it could come in a big peak, it could come in multiple peaks. We do not have the ability to predict at this time exactly how this second wave will appear, although we do feel that there will be a second wave of COVID-19, especially with what I'm afraid will be laxity in how people attend to the public health restrictions that should continue to be practiced. I think that one of the things that we could do is to take a little bit different look. That's what we're doing with the governor, that's what we're doing in our agency and with emergency management, and is to say, what is it we could do to make a second wave not occur at all in the state of Kansas? So that's what I consider to be our agency and our emergency response call to arms. That is the end of my prepared comments. Happy to answer your questions.
Mr. Secretary, could you clarify your thoughts about the governor's decision Tuesday to leave it up to counties to make these decisions? Just maybe skip the political part of it and focus on the health. What do you want counties to do?
Yeah, Tim, that's a great question. What would we want counties to do how do they embody the recommendations, if you will, for going forward? We would hope that they would look at the Ad Astra reopening plan as the continued guidance. I've already gotten assurances from a number of health officers from around the state that they will push for that and hope that their county leadership will as well. There's multiple levels of influence at the local levels, that is at the county level. There's county government and there's health officers. And I'll do whatever I can to help our health officers provide the best guidance possible to the county officials. And I hope that the county officials will continue to look at the Ad Astra reopening plan as the plan that will provide the safest way forward.
Secretary, are there some counties for which that would especially be important given their local situation with COVID-19 or maybe some counties that really should go even stricter than the Astra Plan?
Yes, good question. Should all counties be created equal is kind of what you're asking, Celia. And I think the answer to that is no, all counties are not created equal. We do know that there's about 8 or 9 counties where the bulk of the cases still lie, and that is in the rural counties with meatpacking industries. But now, because those people and those industries also live in the communities, there it's a community issue. And then in the more urban, more dense populated areas with skilled nursing facilities, and then correctional facilities are a little bit of an entity of their own. So if you look at it, it's really about skilled nursing and nursing facilities in general, correctional institutions, and meatpacking.
Have you heard from county health officers from places with either no cases or little cases with what they plan on doing going forward? Or is it going to be like back to normal for those counties?
You know, I've not heard, because this is all relatively just hot off the press, and I think they're actually trying to figure it out themselves. Do they need to have any further restrictions at all, I think is the question that you ask. And I think the answer is all counties don't need to be created equal, and some can have more latitude for easing the restrictions. And I think that there are some counties that have either no cases or very few cases identified. That's a much safer environment to have some degree of latitude. And I think that I would expect that the county leaders, including those health officers, but in answer to your question, I haven't had that specific conversation yet with those local health officers.
Have you spoken to health officers who expect to have their suggestions rejected by the county commission?
That's happened before, and I anticipate, and they anticipate that it'll happen again. And I hate to see it because it's going to end up being a conflict that we hope can be negotiated through, but I do expect to see some of those kind of conflicts. I do know of counties, by the way, and some of them that are the larger counties have said, in meeting with me by phone, have said we're sticking with where we were and we're sticking with where you are at the state level with the Ad Astra reopening plan. But will that run afoul? It very well could, and hopefully that doesn't be the case.
Help us. It's hard to track 105 counties. I think Shawnee is sticking with the Ad Astra. Do you know, just help us with a short list of those who think are doing that?
I'm not going to speak for those counties yet because I don't know the answer to the question. One of the things that I do know is that we do not have a registry that says here's where every one of the 105 counties is as it relates to their own reopening plan. We do not have a clearinghouse or a registry for that at the current time. I would like to, especially in those counties where there's considerable activity, we'll know that because I'll be having regular conversations with the leaders in those counties. But we do not have a registry at this time that follows county by county what each and every line item is for what is allowable or what's not allowed in those counties.
Sorry, has campus continued to do surveillance testing in meat plants, packing plants, and nursing homes, and is the pace of the testing becoming more robust or slowing down?
Yeah, it's actually a good question, Celia. The question is the pace of testing in those kind of hotbed areas going up, going down, or staying the same? And I would say that it's going down a little bit. And the reason is there's fewer outbreaks going on in nursing facilities. And the increased, and I had a good conversation with Ford County on, I guess it was Sunday or Monday, holiday weekend, that they are continuing to do the testing, but as they get more and more results, then they're able to divide people into those that have had it and those that haven't, and it's less testing being required overall. There's more testing going on in the community, but less testing at the employee sites.
Secretary, there are more cases than are actually reported in the official numbers we receive each week. Does the governor's administration have any projections of the actual number of cases in Kansas due to asymptomatic people or underreported cases or limited testing?
The numbers that we report are positives that are proven by PCR positive testing that are not presumptive positives. That will always underreport the true burden of disease in the community, and the reason is because there's a lot of asymptomatic people that will never be tested. So we know that the numbers will always be low. But keep in mind, what are the goals? The goal is to respond to any positive cases, particularly in congregate settings, and then with the goal of, and I'll comment on my science moment in a moment here, of the serology testing. And because that was what will really provide us a good foundation for how much disease has been out there that is asymptomatic. We are right now at the KDHE laboratory in the process of installing the serology testing platform that will allow us to do serology testing for the COVID-19 specific antibody. And that will provide us more information. And we don't have to test every man, woman, and child in the state to have a good understanding of the point prevalence of the disease. There's ways to statistically forecast. If we can get to 2% of the population, we'll know the overall burden of disease, whether it's urban or rural counties.
Do you wish that statewide restrictions would stay restrictions and not become guidelines? And could they go back to restrictions, either spikes or in a second wave?
The latter question, Alec, I cannot answer because it's a legal question, legal and or legislative question, and I don't know the answer to that. What I do know is that I really think there's a benefit in, one, maintaining consistency and having a certain threshold that counties should try to achieve, or should not try, but should achieve for maintaining control of mass gatherings and certain higher risk businesses and industries and the like. I think that we've lost a little bit of the ability to know that, and it wouldn't surprise me if we have a steep wave 2 that there would be very good reason to, as much as we would hate it, to take a step back and say, let's have more stringent requirements put into place. I'm just a doctor. I don't know the answer to the legislative or legal question.
Can you get the virus, then recover from it, then can you get it again, or once you got it one time, you're done? Yeah,
good question. Is the virus one and done, or can you get it over again? And that question is not, the answer to that question is not known. There appear in Asia, particularly in South Korea and Hong Kong, to be people that were test proven positive for the virus that then have gotten ill again and tested positive again. That is unusual in people that have antibodies against a virus. It's unusual for them to get that same viral infection again, at least within a 3 to 5 year period of time. Now, there are other viral illnesses, though. I will make the point that there can be more than one what we refer to as a serotype. Dengue fever is an example. There's 5 serotypes, and you get ill from one of them and have antibodies against it. You'll never have that particular serotype of dengue fever again, but it doesn't keep you from getting those other 4.
Mr. Secretary, can you please rewind and go back to the surge in fatalities? You mentioned Wyandotte County in southwest Kansas. That was just a reevaluation of death certificates or delay in processing, or there's a big surge, and can you divide those numbers for us?
I don't have it's a good question, Tim. The question is 17 deaths since Friday, mostly attributable to Finney and Wyandotte. I didn't go in and look at all the original forms and death certificates, but apparently it was mostly about the timing of the submission of those data through the holiday weekend.
Secretary, can you give us an update at all on the idea of studying municipal sewage? Are you expanding wastewater testing from what you talked about before, and do you believe it will be a predictive tool?
And what was the name of the study, Celia?
I think you're working with KU on...
Oh, yes, yeah. And this is something that I think holds promise, actually. The question is, can one test the wastewater coming out of municipalities and gain an understanding about the disease footprint, if you will, in that community? It's been done, I believe, in Denmark, and I know for sure in Massachusetts, and the answer is yes. It does. The testing that can be done tests a number of the different particle fragments from the virus, very sensitive, because it can be picked up from either urine, but especially in feces. And by the way, it's important to know that those are not, when it comes through a person's system like that and goes through wastewater treatment, it's not infectious. I want to make that point. And the thing that can be fascinating about that is that you can find that in communities that have not had any reported cases of COVID-19. So it probably means that even in those communities that haven't had reported cases of COVID-19, but do have those particles of the virus found in the wastewater, somebody's probably had it in that community. Somebody or somebody's in that community have probably had the COVID-19 in an asymptomatic manner. So the question is, and I think that there's early indication that it can be an earlier indication before cases are even cropping up in a clinical setting. So a lot of questions to be answered yet, which is how practicable is it? Can we train wastewater operators to do the testing? Do you sample how often? Is it quantitative or just qualitative? And then what does that mean? You do, no pun intended, upstream to do further diagnostic efforts in the community itself. I think it shows real promise because, again, it's a surveillance tool and yet to be defined exactly as how it fits in and how practicable it is.
Secretary, Missouri now says that it has traced its first case back to early February. Does Kansas plan to go back and take another look at its first reported cases to determine if there is any indication that COVID-19 was here earlier than first reported?
Yes, we would love to do that, doing the serology testing, because, and I bet you almost everybody in this room and many of your readers and listeners say, oh, that have talked to somebody said I was really sick in January and February, and then this exploded. Did I have it back then? I haven't been sick since. There we go. And the answer to that is, if we can go back and do COVID-19 specific serology testing, I think it would be quite possible to likely attribute that earlier illness to COVID-19. And we would love to do that, and we'll do that as part of our serology testing. We think that we probably have seen cases through self-reported onset of symptoms as early as the second week of February in Kansas.
Is there some bright yellow line at which county health officers will not stand for having their recommendations accepted by county commission?
Yeah, I know the question, Martin. It's a very good one. What if you're what you're really asking is, if a county health officer gets crosswise with, for example, county commissioners, at what point do you say I can't go on in my position, or I can't accept what the commission has done? And I think that's as individual as the setting and as individual as the person involved. It should be a negotiated process.
Do you think the restrictions should be the same in open air as a closed building? A lot of people say you're less likely to get it at, they're closing a lot of buildings in certain areas, but yet they can gather in open air. Do you want to just, in your opinion, with your expertise, just tell them that you can catch it outside as well?
Yes, really good question. Question is outside air a benefit and make it less likely than indoors? And the answer is you're safer outside as long as you're distancing. Lashing together boats in Party Cove is not social distancing, no matter how outdoors you are. And that's what we saw at Lake Perry, and that's certainly what was seen in the Lake of the Ozarks, in addition to the pools. I think an issue with masks is that the mask is particularly beneficial when you think you control your environment, but all of a sudden you don't. You're glad to have a mask on. Masks have become almost political. They become criticized, but masks do work. They're not everything in the world. It won't mitigate to 0% the risk. When you're outside, have a mask, and if you get put together in too small of an area, put your mask on. Wide open spaces. Oh, by the way, sunlight is beneficial for increasing your body's vitamin D level. And without getting into quite all the physiology of it, if you take vitamin D, it requires sunlight to convert it to the active form. The people that have normal vitamin D levels, if they get sick, have less severe illness and less likely of dying. So put on sunscreen and get a little bit of sunshine. I think it would be well worth it from a protective factor.
So if we're like outside in the heat, you said the heat is a big part of it. Can a person be 6 foot away and do without the mask?
My personal belief is that as long as you're socially distanced, meaning greater than 6 feet away and not in close approximation for 10 minutes or more, that you can do that and feel safe about it.
Thank you.
Thank you very much, Secretary.
Okay, thank you.